All right, welcome to the Pulse of New Hampshire. This is Well Adjusted. I'm Nazi, your mediator. I'd like to introduce the host of the show, Dr. Sam, who's an established chiropractor and local hero in our community. Of course, he established Infinite Health Family Chiropractic in order to help create health and wellness for his community, something that he believes and holds dear to his heart. Also, to educate individuals on the value of the chiropractic lifestyle. His mission is to help people realize that health is a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. Joining us, it is Dr. Sam Ayan from Infinite Health Family Chiropractic. How are you, Dr. Sam?
I am doing awesome, Nazi. Thank you very much for that wonderful introduction. Hero, thank you for that.
I can call you a hero because when my son was a few weeks old, you adjusted him with your fingertips, okay?
Yeah.
And he is a very happy and healthy 11-year-old boy right now, and he still gets adjusted at Infinite Health Family Chiropractic. So you're a hero to me.
And that's the importance of being adjusted from birth. I'm pediatric and perinatal certified. So I do see a lot of children and families, and being well adjusted throughout your life is healthy, just why we have the name of the show. So, but I'd like to bring in an expert, a phenomenal mentor of mine, a woman that throughout the country is well respected. She has a lot of contacts. I'll let her tell you about that a little bit with other professions in the sense of helping us develop chiropractic throughout and the importance of it. She is one of the founding members of TLC, which is Team Life Conditioning, which is what I'm part of. And she also does a show on she does a Facebook which is called 6 Minutes of Science. And ever since COVID lockdowns and everything started, she's been doing those. She's been doing a show every evening at 6 o'clock and hasn't missed a day since. So it's going on 400 plus days. So, and it's all about facts and things of that nature. So I'm going to, with no further ado, I'd like to introduce Dr. Jen DePice of TLC Chiropractic. And I apologize about the noise.
I just heard your cell phone go off. I've heard a couple of alerts.
Yeah.
They're all reminding him about this broadcast. I love it.
Great. Well, it's real time, isn't it? So
it is. Welcome, Dr. Jen. Thank you so much for joining the program.
Thank you. It's an honor. I love the opportunity to engage. Anything that Dr. Sam Ayan is a part of is something that's valuable. He invests himself completely in his service to the community, and not just his local community, which is practice, and the state of New Hampshire, but in the whole United States, serving and raising up chiropractors that live the principle of chiropractic. So I love doing that. I love working alongside of him and creating communities and giving people hope. And that's really essential right now. And expressing the truth so people can understand what the truth is and where the risks really are. So Dr. Sam, if you want to pose a question, or if you want me to go,
before you pose a question, really quick, Dr. Jen, tell everybody where your practice is and where you're talking to us from right now.
Okay, great. So I'm outside of Philadelphia in a town called Willow Grove. So it's a suburb of Philadelphia. And my husband and I have a chiropractic practice. So we are chiropractors as well. And I also am involved in the education of chiropractors in schools and academics, as well as coaching other chiropractors and really building a community that helps chiropractors spread the message of chiropractic to more people, because people learning how to live from above, down, inside out affects how they parent and how they work as a professional. And it certainly affects them in terms of their perspective right now in this pandemic that we've been in.
And having said that, that's ultimately why TLC was formed, yes, with your husband and yourself originally.
Exactly.
To encourage chiropractors to help encourage others.
Exactly.
And one of the things that I love about you guys is that it's not just you and Dr. Dean DePice and Dr. Jen DePice show, but there are 28 other coaches, or 28 people And as a community, we work to educate not only students and everything else at TLC, but everybody else. So I would thank you for helping. I've been with you guys. It's going on 11 years now, and it's been an amazing ride. It's been an amazing ride. I just wanted to ask you, Dr. Jen, what was the impetus or the driving factor behind starting the 6 minutes of science that you do every evening for how many days? Close to 400 days now. And why was that? Why was that something that you felt was important to do?
That's a great question. So first of all, like you said, at our heart as chiropractors, it's creating communities. Creating a community where people can gather information, but even more so than getting information, because there's no lack of information around us in the world on any subject that we want to look into, but learning how to ask questions and learning how to look at research and look at data and then interpret it, and then to make it personal to you and your family. And then to be able to assess your risks and assess the benefits of any different health decision that you're making. And to be able to do that in an environment where we're not here in 6 minutes of science to express our opinion. We're here to delve into science and provoke you to ask your own questions, to share what you're challenged by, to embrace what your perspective is, and to not feel judged, but to be curious and to recognize that's the pathway for us, like you said, the name of the show, to be well-adjusted.
Well-adjusted, yeah.
Right.
Yeah.
And some of the contacts that you have that you communicate are big wigs. I mean, in their own right. Yes, you have.
Yes, absolutely.
So, like, who are some of the people that you communicate with to get your information?
Okay, so yeah, that's the fun part of what the reach of 6 minutes of science has expanded. It's on 4 out of 7 of the continents of people that are involved in these conversations now. So that's really exciting. Over 366,000 people are reached by the message that we're involved in. And what Dr. Sam is alluding to is this has opened doors in terms of we as chiropractors to reach beyond the chiropractic profession and to unite different health professionals and academic peers of ours that are also wanting to expand their impact. So Dr. Ralph Keeney from Duke University and previously MIT is one of the professors. Dr. Blade Cottley from MIT and Dr. Stephen Cole from UCLA Medical School. We're all communicating on a very similar agenda of how are we creating a community and how are we recognizing that people that living in community change their genetic expression than people that are living isolated individual lives and have no connection to other people. And that's really a message of hopefulness that we can take in this time period that we're living in that really can move us forward. And that's very exciting to us. And there's a lot of other people. There's people in Washington too that we're working on building those connections that we really believe will be open. I mean, our president says that he has a health equity panel, and we in 6 minutes of science want to be a part of that because we want to allow the choices to not just be based on racial and ethnic choices of equity, but equity of healthcare choices for all people to be represented.
Facts. So here's my question for you, Dr. Jen. How do you handle, because you mentioned people do the research, you get the correct information. How do you handle the misinformation that's out there? Because you can do a Google search for anything and you'll get 50,000 different results. How do you handle and sort through the misinformation that's out there? Because there's a lot of it.
Yeah, that's great. So that's a great question. Well, first of all, I am committed to not being a part of anything in media. So I don't listen and I don't espouse people just getting information from the media, because there's always an agenda of their perspective. So to me, I always encourage us in 6 minutes of science to look at the research that's published. And you may not agree with the research that's published, internationally, but it is data that is based on science. And then from that, then understanding what that reveals. So I always say, let's go to what the research article, not what somebody else's interpretation is. Let's read the research and then find out what the information is. And something that's really challenging to me is that people have this idea that science is static and it's not changing. And that's something that we should all embrace. Science is continually changing, and we're learning more information, and we've got to adapt to that. And sometimes our health policies aren't adapting to the science. And that's frustrating to people like me that are very involved in the day-to-day, like Dr. Sam said, 413 days nonstop, doing 6 minutes of science on trains, planes, cars, outside. People complain, oh, it's noisy. Well, it's real. It's just life. We're always doing it. But I'm always saying, okay, this is what the research says, and go read it yourself. Don't take my word for it. Read the research and understand what it's saying about your natural immunity, and what is it saying about the vaccines. And people get real excited. Why are you talking about vaccines? I'm like, because it's real and it's something that we need to talk about, and you need to make your decision based on the most accurate information.
Right.
She's good, Dr. Sam. You picked a good guest.
Thank you. Well, that's why I asked her to come on, because I know the amount of information that we transfer across. And one of the signs of life is adaptability. And adaptability is something that we sometimes forget. And even within our own abilities to fight a virus, regardless of whether you're getting a vaccine or not, it comes down to our own immune function being able to fight those things. And then and recently I had read something about the WHO, which is the World Health Organization, removing the definition of natural immunity from their explanations. And I'm like, how could they remove natural immunity? And it made no sense to me. And then people, obviously there's always someone, someone has called her Dr. Jenna Quack because she's a chiropractor. Okay, not because she's not a real doctor. She's I'll let her respond to that. And then Facebook, I believe it was Facebook that censored you, or someone censored something because you said something about a vaccine. And one of the things that people, this is just factual information. The vaccine that's out there has not been approved by the FDA. Okay, it's experimental. And if you look at what, I hate putting this out there, but the Nuremberg trials, no one is supposed to be given something against their will or something that they're not wanted. But we're made to feel as though we don't belong if, God forbid, you get it. And these are opinions that aren't based on scientific fact. So I wanted to address a little bit about why exactly you feel that, Dr. Jen, you feel that you may have been censored, and why you think that happened, without getting into too much detail. Obviously, it's a short amount of time, but why do you think that happened?
Well, we addressed that after we were censored, and we've been censored a couple of times. And, it's not our belief that there are people that are maliciously trying to target us. It could be the truth, but we really believe that it's more AI, that they're just recognizing target words and then they're blocking those target words. So maybe that's naive, but it is not our perspective to focus on being attacked, but to focus on spreading hope and love and connecting people in community. So we just keep persisting, and we find other ways to address subjects. And like I said, we really aren't opinionated. So we aren't making a statement of no one should get a vaccine. There are people that, their best option is to have a vaccine. I'm not saying it's for everyone, but I'm certainly saying that there are a sector of our community that would be better served by taking something external. So I'm not as concerned about the censorship. I appreciate that it brings to light what we're not being told. And I think there's a lot in the media that we're not being told. So there's a lot of agenda that's going on. But something you brought up, Dr. Sam, that I really want to talk about, it's one of my favorite subjects, is the criteria to determine that we're in a pandemic. And the World Health Organization had said that there aren't objective specific criteria. And that's very interesting because in the past, when we had the SARS-CoV-1 pandemic, we would think that afterwards we would have gone back and said, okay, well, what are the 5 criteria? And at different times, the World Health Organization has said that it is when the positivity ratio is less than 5%. And if we look currently, we're at 3.8% in the United States right now. So we're well below that 5%. Okay. And they've also said that the reproductive...
what is the positivity ratio? So for those of us that don't know.
Yep, sure. It's of the number of people that have been tested, that less than 5% of the people that are tested are testing positive with the SARS-CoV-2 virus in terms of the PCR test. But I have to put a little asterisk. I get very excited about these subjects because it's not just their clinical laboratory test positives. We're including in that positivity the presumed positives. So there's many people that do not have a positive PCR test that are included as positive tests because they are presumed positive, either because of exposure in their family or that they have clinical symptoms that they are assigned that positive test finding. So that's another subject. So positivity is one of them. RT value. So how is the disease transmitted to more people? So World Health Organization has said when it's over 1.0. So if you test positive and you spread it to one other person, then that is an indication of how likely is the virus of spreading throughout the community. So they have said when it's below 1.0, so you can't transmit it to even one person, it's less than one person, then we will know the pandemic is over. And in the United States, we're well below 1.0 in terms of the reproductive value. Interesting that we're not tracking that anymore. And we're also not tracking the people that are recovered from the virus. So it's interesting how we make different perspectives about what we're valuing. And when we accomplish some of these targets, then we just stop tracking them anymore. And the other 2 ones that I want to talk about is the decreased hospitalizations and decreased number of deaths. And of course, that big conversation about herd immunity. So those are all of factors that are fueling this conversation, like you brought up, Dr. Sam, about the emergency use authorization. Is it a pandemic? And if it's a pandemic, we can go by different rules. But if it's not a pandemic, we don't have that authority to go by the EUA to take away people's rights to be able to make choices that maybe people don't want us to be making right now.
Yeah. So we've got about a minute and a half left. So did you want to do a final thought, Dr. Sam or Dr. Jen, just to kind of wrap things up?
Well, I think that Dr. Jen brought up some great points. What is being valued and what is being reported fulfills a specific agenda or narrative. And then you look at the possible, the CDC's reporting on VAERS, and you see that there's over 2,600 deaths and 80,000 adverse reactions on their website. Okay, and these numbers aren't reported to people. These things, and the VAERS program, which is voluntary, they say is vastly underreported. So it's important to understand that we're opening up conversations. That's the key here. It's to provoke conversations. So people, whether you agree or not, that's okay. But the objective is we need to be able to have the conversation across the board. And Dr. Jen DePice brought up amazing factors, because are we losing our ability to make our own choices, and are we leaving it to someone else? Or are we fighting for the right to be able to do that? And those are the points that we have to really look at and understand, because like you said, this is not just about race, color, creed, ethnicity, religion, whatever it may be. This is about everybody. And is about everybody being there. So I just want to say thank you to everybody
Yeah.
for listening in and just be open-minded
Mhm.
enough to say, hey, let's open up this conversation and say to myself, maybe I should get checked and help to work on building my own immunity
Mm.
and learn how to build my own immunity so that regardless of what situation I'm exposed to, I'll be able to fight it better.
Well said. Dr. Sam, thank you. Dr. Jen, thank you very much. Well adjusted. We'll see you next time on the Pulse of New Hampshire.
Thanks.